Good afternoon, everyone. It's an honor to be here today to discuss Apixaban as a direct oral anticoagulant, which gained recently a comprehensive attention for prevention and treatment of cancer-associated venous thromboembolism in cancer patients. We will explore today the evidence and the safety profile and the efficacy of Apixaban in those high-risk populations. I have a problem here. It's not working.
Slides.
Slide. Next, please. Before we dive deeper into the role of Apixaban in treatment of cancer-associated VTE, let's first explore some key facts about the association between cancer and VTE. I'd like to engage you all by asking a few questions. Afterwards, I reveal the latest finding according to the ESVS 2023 guidelines for antithrombotic therapy for cancer-associated VTE.
So let's start with a few questions about this subject. So what are the percentage of all venous thromboembolic events associated with cancer? Is it 5 to 10%, 10 to 20%, 17 to 29, or 30 to 40%? What do you think is the percentage of venous thromboembolism association with cancer? Is it C, B, A? We'll explore this with Mustafa, inshallah. The next one. Which type of cancer carries the highest risk of VTE, according to the EVS 2023 guidelines? Lung cancer, gastrointestinal cancer, hematological malignancies, or breast cancer? Keep the answer till the next slides. Next. In cancer patients, during which period is the risk of venous thrombosis the highest? At the time of cancer diagnosis, within the first few months after the diagnosis, or 6 months after diagnosis, or 1 year after diagnosis? Go on, Mustafa.
According to the ESVS 2023 clinical practice guidelines, cancer is associated with 17 to 29% of all cases of VTE. The risk of VTE is increased 7-fold in patients with cancer compared to patients without. Hematological malignancy carry the highest VTE risk, and lung and GI cancer second. The risk of venous thrombosis is highest in the first few months after the diagnosis of malignancy, and patients with cancer-associated VTE had statistically significant lower survival rate after 1 year compared with cancer patients without VTE. As a clinician, predicting the risk of cancer-associated thrombosis is important. So what tool can we use to predict the risk of VTE in cancer patients? The Corona score, which is a quick, effective tool to predict the VTE risk in cancer patients, helps to identify high-risk cases and guide preventive care essential for patient safety. The higher the Corona risk score, the more the VTE risk. So, what is the evidence behind the use of anticoagulants in patients with cancer-associated VTE? Guidelines for anticoagulant use in cancer-associated VTE have developed over the years, from depending on low molecular weight heparin and vitamin K antagonist to DOAC. In 2020, the National Comprehensive Cancer Network recommended DOAC for cancer-associated thrombosis for patients without GI cancer, and preferred the use of low molecular weight heparin for those with GI cancer.
So the next question is, according to the ESVS 2023 guidelines, which DOAC is recommended as the preferred choice for patients with cancer-associated VTE with low bleeding risk? Is it rivaroxaban, edoxaban, apixaban, or dalteparin?
We have some error. We jumbled a lot of slides. So we need to come back before this question. Would you please, we need some help here.
Few slides, Abdul.
Yeah. Sorry for that. Furthermore, we have 4 randomized controlled trials have reported the clinical outcome of treatment of DOAC versus the low molecular weight heparin in patients with cancer with acute venous thromboembolism. This is the Hokasai VTE trial for Edoxaban, Select trial for Rivaroxaban, and Adam VTE trial for Apixaban, and Caravaggio trial for Apixaban. In the Adam VTE trial, there was a meta-analysis of these trials showed that DOAC were non-inferior to low molecular weight heparin in preventing all over VTE, recurrence in patients with active cancer. Although there was an increased risk of clinically relevant non-major bleeding, but not major bleeding with DOAC. Bleeding was mainly attributable to GI luminal malignancy. In the Adam VTE trial, 300 patients with cancer-associated VTE were randomly assigned to receive either Apixaban 10 mg twice daily for 7 days, followed by 5 mg twice daily for 6 months, or subcutaneous low molecular weight heparin. The results reported that Apixaban for 6 months was safe with no major bleeding. The Caravaggio trial, a breakthrough study shedding new light on safer, effective treatment options for cancer-associated VTE, a major step forward in patient care. It was published in the New England Journal of Medicine as Apixaban for the treatment of VTE-associated cancer. It's a non-inferiority study comparing Apixaban versus low molecular weight heparin in patients with cancer and with symptomatic or incidental fine VTE. For the primary outcome of recurrent VTE at 6 months, Apixaban was non-inferior to low molecular weight heparin, and the major bleeding events didn't differ between groups. Apixaban demonstrated comparable rates of clinically relevant non-major bleeding events, major GI bleeding and non-GI bleeding versus low molecular weight heparin. Now, we have gone through the evidence supporting anticoagulant use in cancer-associated VTE. With the overview in mind, let's turn to Professor Shaalan for an essential question for the choice of safer DOAC in cancer-associated VTE. The question is?
So again, according to the ESVS 2023 guidelines, which DOAC do you prefer as a recommended drug for patients with cancer-associated VTE and low bleeding risk? Is it Rivaroxaban, Edoxaban, Apixaban, or Dalteparin? Okay.
According to the ESVS 2023 clinical practice guidelines, patients with cancer-associated VTE and low risk of GI or genitourinary bleeding are recommended to be considered for anticoagulation with a DOAC, preferred to be Apixaban, alternatively Rivaroxaban or Edoxaban. To conclude, let's go over the key take-home message on the use of DOAC in managing cancer-associated VTE. Apixaban, the all-in-one solution for cancer-associated VTE. ESVS 2023 guidelines recommended Apixaban as the preferred DOAC for cancer-associated VTE in patients with low bleeding risk. Adam VTE trial reported that Apixaban for 6 months was safe and with no major bleeds compared to low molecular weight heparin for preventing recurrent VTE in cancer patients. And Caravaggio study demonstrated non-inferior efficacy of Apixaban compared to low molecular weight heparin for preventing recurrent VTE in cancer patients. In conclusion, Apixaban provides a comprehensive solution for venous thromboembolism management in cancer patients, combining evidence and safety profile and efficacy, all in a single therapy. Thank you for attention.
So if we have few